Hello, everybody. A warm welcome and good evening for today's session. First of all, give me a quick nod if I am audible and visible. Is the AV quality clear? All good? Good to go for today's. Let me know the comment section. Please to check at my. Is the AV quality okay, guys? Quick nod in the comment section that I'll get the confirmation. Okay. I have started to see my feed. I hope and I believe team is good at your end as well. Hello and welcome, guys, for today's. Everybody's doing good. Yes. Warm welcome to today's session. So, I am Dr. Hitesh Nathani, mentor, your educator, your friend on this wonderful platform of Unacademy. I hope everybody is doing good. Thank you, Renu. Thank you for that confirmation. Yes. So, today, what we are going to do, guys, we are going to be discussing a lot of MCQs along with some important topics which have been asked previously when it comes to anesthesia as a subject, right? So, a quick intro about me. Hi, Ames Rakesh Kumar. Good evening. How are you doing? A quick intro about me. I am Dr. Hitesh Nathani, your educator, your mentor, and your friend for the subject of on this platform of all right. So, what we are going to be doing today, we're going to be discussing some important CQs, right? When it comes for your examination, right? So, with respect and targeting our FMG examination is due in the month of December. We are going to solve a lot of MCQs, and those will be some important topics that will be discussed, right? So, which have been asked previously, which have got a lot of chances which can be asked. All right. So, is the voice breaking, guys? Let me know in the comment section. Is the voice breaking, Pranav? Other people, is the voice breaking? Let me know about that. So, with respect to the FMG classes that we have that will be taking, right, from August 25th onwards, that is from Friday onwards, we are going to be having a lot of free live classes. That is the special classes on the Unacademy app, right? So, if you have not yet downloaded the app, you can download the app, and we'll be having a lot of that is special classes that we call it. That is free live class, right? These are free live classes which will be there. We will be taking on the platform, and for the subject of anesthesia, we'll be taking on August 27th, 9 p.m. Right. Apart from that, you can see from August 25th to 31st, that is a special class week that we have just for the FMG. That is must know topics and MCQs that will be. All right. So I hope the voice has been clear by now. Yes, guys. So for the FMG people, we have launched Target 150 plus for the FMG December batch, right? So what is this? This is your ultimate revision plan in which there will be more than 150 plus hours of high yield practice, that is MCQs, as well as your theory section that will be covered in live sessions, right? We'll have rapid revision, we'll have live discussion and live doubt solving things, right? Most of the time, what happens? We take up some studying, start to study, and then what happens? There is some doubt, and then we say, "ये topic बाद में पढ़ूंगा." I'll come back and again revise this topic, right? But what happens in that flow? We actually forget to again come back and revise that topic, and at the end, when we enter the examination hall, that topic remains a question mark in our brain, right? So therefore, live doubt solving is very important. So you can take this subscription at 20% off that you are able to see on the screen, right? So this offer is valid till August 25, right? So you can take this course at 20% off. You can see the effective price, that is 560. for next 4 days. This will be your effective price. If you want to subscribe, you can use the code Dr. Hitesh for any, right? Along with that, there is this iconic subscription which is my favorite, by the way, right? You have access to Unacademy Plus, you have access to notes, you have access to mentoring sessions by the Unacademy, how to prepare, what are the experiences when we take interviews, what are the things to be studied. All those things are combined into one plan now, that is iconic subscription, and you can get the subscription at very cheap. All right. So plus will have your live batches plus the recorded content, right? That is very, very, very important, right? So you will have QBank, you will have access to more than 10,000 plus MCQs, you will have PYQs, you will have notes, you will have mentoring sessions. Everything is combined into one. All right. So let us start the session for the day. Just give me a quick nod in the comment section if everything is okay. So we will start with the first MCQ for the day. Let me know in the comment section if everything is okay. So we will start with the first MCQ, and every MCQ is gonna be a poll based question, right? So you have to answer the correct amongst the options in the comment section. All right. Thank you, Renu, for that confirmation. First question on your screen. The maneuver shown in this image is, right, manual inline stabilization, head tilt, chin lift, head extension, or jaw thrust, right? What is the maneuver that is shown? Why this image holds very important part in our preparation? Because this question has been asked twice in last 1 year, right? So you have to be well versed with such images. You have to be well aware of such images when it can be asked in the, right? The maneuver shown in this image is, Priya says it is option B, Renu says B, Chandani says it is yes, Gagan, Pranav, Saurya Ruchi says yes, it is option B. Very good, guys, very good. See, just by looking at the image, you should be able to make it out. Where is the examiner touching? Examiner is touching at the chin. What is he doing? He is lifting up the chin, right? And along with that, what is he doing? He is holding the head and he is doing the head tilt position as well. What it is head tilt, chin lift, right? Head tilt, chin lift maneuver, right? Just with our common sense, we should be able to answer this question. Right? Most of the times, what happens? We confuse it with head extension and jaw thrust, right? So when we want to extend or when we want to give a jaw thrust, you just put your fingers at the angle of the mouth and you protrude the jaw. This is known as jaw thrust maneuver, right? Okay, this is known as jaw thrust maneuver. And what about manual inline stabilization? Manual inline stabilization is something like, when do we do that? This is manual inline stabilization. When do we do this? We do it whenever we suspect cervical cord injuries, right? Whenever we suspect cervical cord, right? Okay, so this is manual line stabilization that you are seeing here. Okay, everybody got it? All right, moving on to the next question on your screen. Following is used in, the one image that you are able to see on your screen. Tell me, following is used. Is it used in brachial block? Is it used in neuromuscular blocking or neuromuscular monitoring? Is it radial artery monitoring that we are doing, or it is a BIS monitoring? Yes, this BIS monitoring, bispectral X monitoring. Yes, Priya says it is option B. Chandani says option B. Renu, well done. Vetarun, very good. Sauryaduti, well done, guys. So everybody of you are telling that it is neuromuscular monitoring. That is just, if I zoom into the figure and if I show you the image, what is it that you are seeing here? There is something written as TOF, right? Are you able to see that? There is something written as TOF. What do you mean by that? TOF is train of 4 or trough monitoring that we call it, right? Train of 4, right? TOF, TOF monitoring. We just focus on that. Where did we study the train of 4 monitoring? Studied it in neuromuscular blocking drive. Exactly correct. Yes, Chandni, Renu, yeah, Chandni. Yes, it is train of 4. What happens with brachial plexus block? How do we give brachial plexus block? That is an invasive monitor, right? It is invasive monitoring. But here, what is happening? You are able to see these electrodes. It is non-invasive, right? You are putting the electrodes on the skin. That is transcutaneous stimulation of ulnar nerve is happening here. Which nerve? Ulnar nerve, right? Is most commonly monitored nerve for neuromuscular. So radial artery, can it be done? No, again it is invasive. And why? Because this aspect of the hand is ulnar aspect. So radial artery is out of question. So I'll just strike it off, right? This monitor, do we apply it on the hand or on the forehead? This monitor is applied on the forehead. Why? Because we do a EEG monitoring with this. That is electroencephalo monitoring, right? EEG monitoring. Yes. So that is used for, very good, Chandni. That is used for depth of anesthesia monitoring. This monitor is used to monitor the depth of anesthesia, right? Brachial plexus block, invasive monitoring. There you will have a needle, stimuplex needle, where you will stimulate the brachial plexus, right? Instrument can be similar, but there will be a needle along with it. It is not a non-invasive, it is invasive monitoring, right? Since this is a non-invasive monitoring and it is stimulating the ulnar nerve from the skin surface, therefore it is neuromuscular monitoring, and with the help of TOF you should be able to identify. Again, this was a previously asked question, right? So look at the topics that we are taking, guys, today. Very important topics, right? Next question on your screen. Identify the following in white. Is it SpO2? Is it EtCO2? Is it MAC? Or is it IAB? Right? SpO2 is saturation. EtCO2 is capnography. MAC is minimum alveolar concentration. IAB is your invasive arterial blood pressure monitoring. What it is, right? Renu, Chandni, well done. Look at the following in white. Which is there in white here? This particular part, right? So what is it thing, right? Rest of the people, Vetarun, Saundarati, Priya, yes, Rashi, very good, Rashi. So what it is the following in white, right? So it is again a previously asked question, right? You're able to see the graph going up and down like this, right? In this manner, and you are able to see a number here, right? It is actually telling you about the expired or end tidal carbon dioxide, that is known as EtCO2, right? What is EtCO2? It is a graph which is made with expiration, that is end tidal CO2, EtCO2 against time. When we monitor the EtCO2 against time, it is known as capnography. This is the EtCO2, right? What about the rest? The green one is what? The green one is what? This is your ECG, right? The green one is your monitor, right? The blue one, the plethysmograph, the waveform that is going up and down like the wave. Yes, very good, Shwetarun. Yes, Monica, Rashi. It is your SpO2 that was asked, right? SpO2, which was there in the option, right? The red one, again the same waveform, but here it is mentioning 134 by 78. This is your IABP monitoring, right? This is your IABP, that is invasive arterial blood pressure monitoring. Usually we measure the blood pressure in the non-invasive manner, right? Correct answer here is ECO2. We have discussed about the rest, SpO2, IABP. What about MAC? This here is MAC, zero point 0.7. That is your MAC, right? What do we mean by MAC? It is minimum alveolar concentration, right? What is the definition? That is the minimum alveolar concentration when we are giving inhalational anesthetic, right? That is required to render the patient unconscious or not responding to any noxious stimuli. That is known as your minimum alveolar concentration, right? Very good, Renu. Yes. Vetarun? Yes, is correct. Coming to the next question, again related to your capnograph. This was asked again in NEET PG. Identify the following capnograph or the following capnograph suggest. Option A, rebreathing. Option B, spontaneous efforts. Option C, pulmonary embolism. Or option D, that is malignant hyperthermia. What does the following capnograph suggest? Yes, very good. Yes, Chandni says it is spontaneous efforts. Priya, Monica, Renu, all three of you again are telling that it is option B, that is spontaneous effort. Yes, Sorry, Aditi, very good. Marvels, yes, very good. It is option B, it is spontaneous effort. All of you are correct. Why it is option B? What is happening here? This is the reason. What it is called? There is a cleft, there is a notch, right? That is happening in phase 3 of capnograph, right? This is your phase 1. This is your phase 2 where there is upstroke. This is your phase 3, and then this is your phase 4, right? These are the four phases of the capnograph, right? What are those? Phase 1, phase 2, phase 3, and phase 4. These are the four phases of what is happening in phase 3. What is happening in phase 3 here? Yes, there is this in drawing. There is this notch. This is known as curary cleft or curary notch. Very good, Smetaran. Yes, Chandni, both of you have given correct answer. This is your curary or curare notch. Why it is called curare? Because curare, remember, was the first muscle relaxant to be used, right? So that is your curare notch, right? So the patient is coming out of your muscle relaxant and starting to take some deep breaths. There are some little efforts, that is your diaphragmatic contraction, or some spontaneous efforts that the patient is trying to take. So there is a cleft, that is the patient is trying to inspire or take little inspiration, right? So this is your curary cleft or curary notch, right? The following capnograph suggests it is option B, spontaneous efforts, right? How will you find rebreathing? What is pulmonary embolism got to do with EtCO2? What about malignant hypothermia? So when you study a topic, previous year question, that means you have to study the entire topic, right? So when you are studying about capnograph, you should know all the different types of capnograph. Got it, guys? That is how you study. Yes, Joel, very good. Coming to the next question. Identify the following. Is it a nebulizer? Is it a face mask? Is it a HFNC, that is high flow nasal cannula, or is it a Venturi mask? Yes, what would be your answer? Chani has asked a question, velocity can be find the one which is fast with it. That was regarding the previous question, right? All of you are telling that it is option D, Venturi. Priya, Renu, Chandni, Monica, well done. Shwetarun, Gagan, Sauryadutti, very good. Again, Priya and Renu says that it is fixed FiO2, that is your Venturi mass, right? Look at the color that is present here, right? Green color, blue color, yellow, orange, white, red, right? There are different colors which are attached to the normal face mask. So what is happening here, guys? There is something strange which is happening with regards to your face mask, right? So what it is, let us have a look at that, right? When we apply a face mask, what happens? The patient takes breath and patient's like gives out the breath. That is known as your one breath cycle or one respirator. In that, what is happening? the FiO2 that is going to the patient. At room air, what is the FiO2 that we are breathing, guys? At room air, what is the FiO2 that we are breathing? It is around 20 to 21%, right? This is the room air FiO2, that is fraction of inspired oxygen. How much oxygen is present in air? Around 20 to 21, right? So when we want to give more oxygen, we give it via different devices. Those are known as oxygen delivery devices. Those are known as oxygen delivery devices. That is the devices which helps us in delivering the oxygen to the patient, right? Of those, one of that is Venturi mask, right? One of those is Venturi mask. So what happens with face mask? Face mask, you can deliver the oxygen depending upon the patient's effort and the flow of oxygen that you have kept, right? So with face mask, the FiO2 is dependent upon two things: patient's own effort and the flow of oxygen that you have kept, right? But with Venturi mask, this FiO2 is fixed. How it is fixed? With this different color coding, right? What is the formula used here? It is the Venturi principle. Therefore, these are known as Venturi. Got it, guys? So this is a fixed FiO2 or fixed performance device in which you should be able to deliver a fixed FiO2, right? If I want to deliver 40%, I'll use X color. If I want to give for 60%, I'll use Y color. Okay? Yes, Venturi's principle or Bernoulli's principle, Shwetarun, Priya. Very good. Yes, that is right. All right, Chandni, got your question. Yes, Rashi. Coming back to the next question regarding the oxygen delivery devices. Maximum FiO2 delivery is by Hudson mask, NRBM, nasal cannula, or Venturi mask. What do you mean by NRBM? It is non, R stands for rebreathing, BM is bag mask or face mask, right? Non rebreathing bag mask or non rebreathing face mask. Maximum FiO2. So at room air, we are breathing around 20%. What is the maximum FiO2 that the patient can have? It goes up to 100%, right? So amongst the following, maximum FiO2 is delivered by which of the following, right? So Renu, Chandni, Monica, Gagan, Priya, Marvels, Nirmala, Ashi. All of you are telling that it is option B, that is non-rebreathing face mask, right? With Hudson mask, how much FiO2 you can deliver? From 25% up to 45% you can deliver. This is also with your nasal cannula. With Hudson mask, if you increase the flow, you can go up to 60% at times, right? But usually we consider the range around from 40 to 55 or 40 to 60, right? With nasal cannula, here it is from 25 to 44%, right? Okay. What about Venturi mask? We have just seen that it is fixed performance device. So what do you mean by fixed performance? Your FiO2 value is fixed. It can range again from 40% up to 60%, right? But what about NRBM? That is non-rebreathing. With every breath, there is no rebreathing happening. You are getting all the fresh oxygen, right? So what is the maximum FiO2 that can be delivered by NRBM? It can go as high as up to 95%. That is such an incredible amount of oxygen that can be delivered, right? So here are the different oxygen delivery devices that you can see on your screen. First one is your nasal cannula, FiO2 25 to 40 to 44%, right? Face mask 40 to 60%, right? Venturi mask, again it comes to around 60% max, right? But look at this device, NRBM. It can deliver your FiO2 to 95%. That is the maximum amongst the following options. But look at the one on your right here, right? High flow nasal cannula, HFNC. With this, you can deliver up to 100% all the gas that is being delivered to the patient. can be oxygen with this. That is how important this high flow is. Again, if you see from the COVID time, this question has been asked thrice in the right. So if you look at it from the perspective of all of the following, if high flow nasal cannula was there in the option, you would have gone with that, right? But since that is not there in the option, we will go with second best, that is your NRBM, non rebreathing. Got it, guys? Got it? Next question on your screen. The size of this IV cannula that is shown: 16, 18, 20, or 22. Size of this IV cannula. This green color of IV, right? What is the size of this IV cannula? Excellent, excellent. Monica, Saurya, Priya, Renu, Vitarun, Nirmala. Yes, confused. Renu, Gagan, yes. Rashi. Nirmala says A, that is 16. Marvel says B. Rest all of you are telling that it is option B. And it is green color, right? Suppose if I change the color this to blue one, right? If I change the color this to blue one now, what would be your option? Right? Size of the IV cannula. Now it is blue color. What would be your answer? Yes, let me know in the comment section if it is blue color of IV cannula. Yes, Renu, Sweta, Nirmala, Chandani. Yes, I am seeing the options. Again, you guys are deleting those. Yes. See, it is absolutely fine to commit mistakes here, right? It is better if you commit the mistakes here so that you don't commit the same mistakes in the examination. That is the point that I want to drive, right? So the more the number of MCQs you will solve, the better you will become with your preparation. Excellent, guys. Excellent. Next one, I am just giving you this pink color of IV cannula. Let me know in the comment section what is the size of the pink color IV cannula. Yes, what is the size of this pink color IV cannula? Pink color. Excellent, excellent, guys. Very good, Nirmala, Monica, Renu, Chandani. Very good, Priya, Renu. Yes, yes, Saurya, yes, Gagan. Everybody of you are correct. Now tell me size of this IV cannula. This purple or violet, right? What is the size of this IV cannula? Purple or violet color? Yes. What is the size of purple or violet? Yes. Purple color IV cannula. What is the size? Excellent, excellent, guys. Yes, Renu, Chandani, Nirmala, Monica, Gagan. Very good, Priya. Yes, Shwetarun. Good one, guys. Good one. Next one, yellow color. How would you identify the size of yellow color cannula? Right? What is the size of yellow color of IV cannula? Yes, then orange and gray, only those two will remain, right? So I will help you understand, I'll help you remember this forever with the help of an image. Very good, Shweta, Monica, Nirmala, Gagan, Chandni, Rashi, Marvels. All of you have given correct answer. Yellow color is your 24 gauge, right? Just remember this image. You will never ever forget what is the color and the size. Start from bottom. What is present beneath the earth is lava, right? What is the color of lava? Is orange color, right? The color of lava is orange color. So what is the color of lava? It is orange color, right? Next comes above the lava is your soil. That is your gray color is soil, right? Above the soil there is grass. Nowadays there is rainfall, so all of the earth is covered with grass and plant, right? So above the soil is green color grass, and there is a beautiful pink flower, and after that comes your blue sky, and in the sky there is this nice shining sun which is yellow in color, and then beyond the sun there is stars which is twinkling stars, that is violet, right? So go from below above, that is orange, is 14, then comes gray, that is your soil, 16, then comes your plants or greenery, that is 18, then comes your pink color flower, that is 20, then comes your sky which is blue in color, 22, then is your sun which is 24, and beyond the sun there is the stars which is violet, that is 6. Yes, got it. All right, samjha. Now you will forever remember this. Yes, you will never forget this. Okay, next question on your screen. The inhalational anesthetic which is shown in this figure, the color, right? This inhalational anesthetic causes what? Nephrotoxicity, hepatitis, cardiotoxicity, or bronchial asthma. First, you have to identify the vaporizer color. The red color of vaporizer indicates which inhalational anesthetic agent. Excellent, right? Priya, Monica, Nirmala, Chandni, Sweta, Renu, Saurya, Manish, everybody of you have given correct answer. Very good. Yes, everybody is telling that it is halothane. Excellent, guys. Full marks on that. Red color, it is halothane. Halothane. So how do we remember halothane? Triple H. Remember H for halothane, H for heart, and H for hepatitis, right? Triple H. Yes, WW जिसने देखा होगा, they'll remember that triple H thing, right? So H for halothane, H for heart, H for hepatitis. What it does to the heart? It is a direct myocardial depressant. Direct myocardial depressant. It is a direct myocardial depressant. So what will happen? It will act on your SA node, will cause fall in your heart rate, will also cause fall in your blood pressure or mean. Got it, guys? And next, H stands for hepatitis. It results in hepatitis. How? By the formation of TFA, that is trifluoroacetate or trifluoroacetic acid, when it undergoes metabolism, and this acts as an autoimmune reaction which results in the hepatitis, like autoimmune destruction of the hepatocyte, right? Yes, Chandni. Coming to the other colors of your vaporizer, right? How do you remember them? Yes, whenever there is a sunrise or whenever there is a sunset, how is the sun? The halo around the sun is red in color, right? So the halo around the sun when the sun rises or the sun sets, it is red in color. So halothane is red in color. How? The halo around the sun is red in color, right? Everybody of you must have eaten aloo bhujia, sev bhujia, bikaner bhujia, nylon save, right? In the hostels, whoever live, they know what is the importance of that sev bhujia, right? We all have those packets, right? So save, what is the color of save that we eat, guys? The save that we eat, save. What is the color of save? It is yellow. So sevoflurane. Sevoflurane is yellow in color. Remember, save is yellow. So sevoflurane is yellow, right? Now, what is the color of Indian cricket team's desi jersey, right? When in blue, desi jersey, desflurane, desflurane, desi jersey of Indian cricket team is blue in color. Desflurane, desflurane, desi jersey of Indian team, right? What is left out? The purple or violet, right? So what up? All of you have seen that Dil Chahta Hai movie, yes? that after that song Koi Kahe Kehta Rahe, yes, when Amir Khan proposes to Preeti Zinta, he gets a nice punch in his eye, right? When he gets punched out in his eye, Saif Ali Khan says, "Arey, your color of the eye is very different, right? What is the color of the eye when it gets punched out? It is violet or purple color, right? So Amir Khan, eye for eye, eye for eye. So eye of Amir Khan, isoflurane, isoflurane, eye for eye. Isoflurane is purple in color. Got it? Yes. Any doubts so far? Now you will remember halo around the sun, red. Save bhujia, Bikaner bhujia, save bhujia, nylon save, sevoflurane yellow, desi jersey of Indian cricket team. Then in blue, desi jersey is blue color, right? And I for I, it is purple in, right? So all of these things you have to remember because such questions are frequent, right? So I hope and I believe everybody has understood and have taken some very important notes with aspect to today's topic, right? So whenever you're studying for your examination, remember guys, first and foremost, you have to concentrate on previous year's topic. Very, very, very important thing. Most of the times what happens, we get lost in the subject matter that is available to us, right? My request to all of you would be to first take up last 3 years questions. Whenever you're taking any subject, go through that, note down the topics so that you know which are important ones, right? And then when you start reading, stress upon those topics more than others. Got it, guys? This is a very easy and simple trick to remember. How do you prepare for? Come to the live class, solve MCQs, get better with your topic, right? So I hope you guys enjoyed today's session. Yes. Any doubts with regards to today's session, today's topic, anything that you want me to take in particular? Because we are having a special class on 27th of August, 9 p.m. Right? If there are any topics find difficult, if there is anything that you want me to take up in that special class, let me know. I'll be more than happy to. Thank you, Chandni, for your kind words. Yes. If there are any topics, let me know in the comment section. Let me know in the Unacademy Telegram group. Let me know in the community section in our app that, sir, I am finding this topic difficult. Please take this topic in the upcoming sessions. I'll be more than happy, right? Otherwise, we are meeting again on 27th of August, 9 p.m. for a special class on our app. All right. Thank you, Sweta. Thank you, Pranav. Thank you, Priya, Renu. Thank you, Monica. I hope you guys enjoyed today's, right? Till we meet again, guys. Your host, your mentor, your educator, your friend, signing off for today, guys. Bye bye. Take care. Stay blessed, stay disciplined, and stay motivated. Before going, don't forget to subscribe like this, right?